Hi, I'm Joe McClung with FloodGate Medical, and I'm here with our ENT expert, Ashley Connolly. And we are back from the city of brotherly love and here to report on what we heard, smelled, and tasted. We promise only 1 or 2 Philly cheesesteaks. Just kidding. We're here to share with you all of the buzz at this year's AAO annual meeting held in Philadelphia. Ashley, wouldn't you agree that this consensus was this year's the bigger and better and game-changing devices ever come to the ENT space?
Yes, that's absolutely right, Joe. This show welcomed over 185 vendors from all over the world and offered over 400 educational sessions to help attendees stay up to date on the best practices as well as the most pressing issues throughout the many specialties in the ENT space. These groundbreaking showcases were held both in private seminars as well as live presentations at the booths on the trade show floor. One of the biggest innovations that I'm super excited about is by our friends at Acclarent. As a true leader in developing minimally invasive ENT technologies, they have rolled out their FDA-approved TruDi shaver blade. As a single-use electromagnetically navigated blade, this is paired with their RhinAer S120 shaver for the incision and removal of soft as well as hard tissue or bone in many surgeries. These surgeries range from ENT, maxillofacial, head and neck, as well as ENT skull-based surgeries. The TruDi shaver blade is a navigable blade with distal tip sensor integration, which displays the blade's position and opening on the TruDi navigation system. This tool is truly groundbreaking technology with accuracy and precision that gives physicians the utmost confidence in endoscopic sinus procedures.
Wow, that is some really cutting-edge technology, no pun intended. One device that caught my eye at the beginning of the show was Aerin Medical's new improved RhinAer, which was recently FDA approved and launched on the trade show floor. This new product provides patients with a comprehensive solution to both chronic rhinitis and congestion. RhinAer uses a non-invasive, temperature-controlled radiofrequency energy to disrupt the posterior nasal nerve and treat the inferior turbinate. Do you know that these are the main causes of postnasal drip and congestion as well as runny nose?
No, I had no idea.
I didn't know that either. After treatment with RhinAer, patients reported a significant reduction in rhinitis symptoms through 2 years post-treatment. That's a good trajectory. As RhinAer is designed to treat both your runny nose and your congestion, talk about killing 2 birds with one stone.
Yeah.
I know that'll help me.
A new product launching on the trade show floor. Talk about buzzworthy news. Another groundbreaking innovation that really sparked our interest was the Hemostatix thermal scalpel at C2DX, as this is the only surgical instrument that uses thermal energy to seal blood vessels as they are incised. The surgically sharp blade enables surgeons to make precise dissections and achieve immediate hemostasis, resulting in maximum visualization and unmatched surgical control. With this new instrument, there is no contracting of muscles, minimum damage to surrounding tissues, and reduced blood loss. Also, did I mention, because this instrument uses thermal heat, that it is safe for patients with pacemakers and other cardiac implanted devices? Yeah, talk about a company and a product that can expand into multiple spaces, even outside of ENT.
Yeah, absolutely. And there's some implantables in ENT that have that need as well.
Yes.
Wow. That new scalpel sounds hot. Another must-watch company and device in news that is right off the presses comes all the way from South Africa. Medinotec Incorporated, they have paved the way as a leader in tracheal non-occlusive airway dilation technology. And we're at the show promoting their award-winning breathable balloon catheter called the Trachealator. This product was developed to address the unmet global need, the specialty of advanced airway management, more specifically tracheal dilation. In addition, the innovative product is world's first in its ability to dilate a patient's airway while maintaining ventilation to the patient without obstructing it. It's pretty impressive. Thankfully, our physicians can now have a safe, effective tool, especially in this post-COVID-19 era. As you can see, there are many advancements throughout the ENT space and the many specialties that fall within. We're excited to see the development of these new devices and watch them truly transform patients' lives. Let us know what devices you're excited to see implemented in the ENT space in the comments below. And we hope to see you at next year's AAO. And until then, keep it silly, Philly. Thank you.
Thank you.